It's a global pandemic. That both creates and adds to poverty. Its stigma alone can be deadly. In the midst of HIV and AIDS destruction, countless agencies, organizations, and individuals labor to loosen the disease's grip on communities across the world. As an institution, the Catholic Church is one of the largest and arguably one of the most effective organizations in the struggle. It cares for 1 in 4 people living with HIV around the world. Yet much of its work is unknown and often misunderstood. What makes the Catholic Church so uniquely suited to respond to what many consider the public health challenge of our time? This is the 5th segment of a series about the Catholic Church and its response to the pandemic. Here, we see how the Church is bringing antiretroviral therapy to the most remote areas of the world, and with it, renewed hope. Approximately 33 million people in the world are living with HIV and AIDS. The disease has become a devastating obstacle to efforts to fight poverty, improve health, and promote development. Anyone can become infected with HIV: children, teens, the elderly. But most often it is transmitted to people in their prime productive years, impacting childcare, elder care, food production, community development, and thereby affecting entire communities. However, the introduction of antiretroviral therapy has rendered HIV a manageable disease. People on antiretrovirals still have HIV, but their immune system is stronger. Treatment allows patients with HIV to regain the strength needed to work and care for their families. This remarkable recovery and return to a full productive life is often termed the Lazarus effect.
We see people who in early 2004, when antiretroviral therapy became more available through the Presidency Emergency Plans for AIDS Relief, being literally brought into clinics by relatives in wheelbarrows, thinking that they were going to die in the hospital or clinic. And to watch these same people 3 months later, or 3 weeks later, walk their wheelbarrow home themselves after having been on treatment, and within months are back into normal activities.
My name is Mutinta Kalenga. I've got 4 children. Before treatment, I was very sick, in, out from hospital, 1 week home, 2 weeks in hospital, like that. But now I'm all right. I'm fit. I'm able to go to do my business. Put 30 bottles of soft drink at my cooler box, carry on my head. Walking with my cooler box on my head. Go up there to the border and put my drink there, start selling. So when I was sick, I couldn't manage to do that. But now I'm able to do my hard work.
In large part, the advent of treatment availability in the developing world is a result of those communities of faith and those activist organizations who differ on many things, but agreed on this one thing and worked together to bring antiretroviral therapy within the grasp of many, many people that would not have otherwise had that available.
Until recently, antiretroviral therapy was unavailable in much of the developing world because of its high cost. In addresses to the United Nations, the Vatican has committed the Church's thousands of hospitals, clinics, and charitable programs in the developing world to bringing antiretrovirals to those who need it.
As we are able to bring antiretroviral treatment to people living with AIDS in developing countries, it's really important to develop those structures in the rural areas because we need close monitoring of people as they take these medications. We need to be sure that they have a steady supply of the medications and they take them regularly at the time that's prescribed for them to take them. And if people simply go into an urban capital once a month to pick up a supply of medications and no one follows them, they have no one to discuss discuss the effects of the medications with, they have no one to remind them to take their medications, then they're less likely to be adherent to these medications. And again, that is why the church is developing more and more the community-based medication programs to be able to assure that people have the supply and to be sure that they are adherent to the medications.
The church's treatment programs are incredibly active, serving people in urban as well as remote rural areas. What makes the programs particularly successful is the host of support services that ensure treatment works. In all, the church provides a holistic treatment program that includes testing to determine if a person is living with HIV and how far the disease has progressed, antiretrovirals and related counseling and support directly to patients and their support systems and families, and education of patients regarding the importance of lifelong adherence to the antiretroviral therapy regime. Adherence decreases the likelihood of developing resistance to medications or contracting opportunistic infections. These, along with good nutrition, productive livelihoods, and providing training and equipment to hospitals and clinics, help lessen the impact of the disease.
When one is infected, all the hope is gone. And of course, there has been no hope previously. It was death. The advert was HIV, catch it. There was a thin man and a coffin. Okay? No hope. But now there is hope. There are ARVs. And we are returning to life. And the hope and the confidence has been given back to us.
As the church continues to provide on-the-ground care and treatment for those living with HIV, it is also actively involved in advocating governments, pharmaceutical companies, and research institutions to provide access to safe, child-specific medicines for children with the disease. This is part of the wider effort of the church to reach out to the youngest of the pandemic's casualties, including the millions of children orphaned and/or made vulnerable by HIV.
No one to go to. No one to turn to. I almost collapsed, but something came into my mind. I'm the eldest. If I collapse, how will the young boys behave? How will the young children sit?
In the next segment, the Catholic Church makes an ardent appeal to aid the most vulnerable, children living with HIV, and those who have lost their parents to AIDS. To learn more about HIV and AIDS and how you can respond, visit crs.org/World AIDS Day.